I just want to do a very quick update. I just came back from general practitioner. I went to a family clinic near my place to check on two things. Number one is, of course, my hair. My mom just updated me that day after the family discussion regarding that bald patch, that when I was young, pretty much an infant, there was some form of blistering that took place over there, and it just didn't go away for a very long time. And mom just listened to some elderly that there's a way of getting rid of it, and she did that. I don't know what she did. She just I think she burst it and then applied some form of antibiotic or something there, and it was treated and hair grew back. So that could be a case. So I went. Another thing I went to check was my ear. My this ear was perpetually blocked. I know it's caused by sinus, but I just want to be sure. I don't want it to be. I was suspecting it could be the case of too much earwax. So I watched a lot of YouTube videos, as always, regarding flushing out the earwax and everything. So I went to the general practitioner, the family clinic, and the doctors saw my ear, and he thinks that my ear is very clean, extremely clean. Actually, he said, quote unquote, and he thinks that it's just a nasal mid-ear. He gave me a nasal spray, which is this thing. It's the very first time I actually used a nasal spray, and it's quite weird. But I don't know whether is it helping. But as of now, I'm speaking. It's not blocked, but I can still feel something. It's got to do with I don't know, your mid-ear or something like that. I can't remember the term. He also gave me antihistamine for reasons unknown to man. I mean, to me at least, because I know antihistamine is for itch. Also for the hair, he thinks that it's just a skin condition, and he gave me well, I can't recognize the name. Dermason, right? So which is just a derma cream, which is 0.1%. And I remembered coming out from my operation, I was given 2 tubes of this for my nose, which actually is the same thing for eczema. So I think the hairstylist who first suggested for me to go and see a doctor regarding this, he's right. I mean, he's got it's some form of eczema, some form of skin condition, and the doctor mentioned that if you leave it be, it will grow back, ranging from 6 months to 6 years. I don't know whether he's scaring me about it, but I'm applying the more concentrated one because I don't know whether they're referring to the same thing. The one that he prescribed me is 0.1%. The one that I got from the hospital out from the surgery is 0.5%. I got 2 tubes of this that I haven't really used. So I think I'll use this, and I think it's a general cream that is applicable for everything. He said that if worse to worse, then I need to go for surgery, and with I'm not surgery, go for injection. And he also said that, since I'm seeing the surgeon on Thursday, I should just go and ask him. So in other words, does that mean that he actually doesn't know what it's about? So anyways, that would be the update for what's this. So hopefully, I can get my hair back. And I really need to eat. And also the cycling that day almost killed me. I don't know whether is it because after losing some weight, my body shape a bit changed and the bike doesn't really fit me as much. But the whole feeling is just very different, very tiring. I got a lot of soreness on my back, on my leg, but I'm recovering pretty well. I really want to go cycle again. And that night, just nice, after chewing a banana, my mom told me that she spoke to the nurse who was at my operating theater that day, who went through the same surgery as I did. Reminded her to tell me that I'm strongly suggested against trying to chew anything because it will affect the final results. So I don't think I'll be doing any more chewing on anything from now onwards. Same extent to anyone who's watching this and going through this process. I think really you gotta be patient. If you really want the best outcome, keep to it. And one more thing, I was so angry. Recently, I spoke to someone. I don't want to mention name. It's an insurance agent from a company I don't want to disclose. Apparently, they are just trying to do a questionnaire on me, and the thing is, there's a lot of problems. What happened was he's just mentioning that on WeChat, I don't know why he says something like this. He says that, this is something that you want to claim, but then now you're announcing to the whole world that you're doing this. It's as if you're doing this just to achieve a better look. And I was really pissed off. I was just asking him. I said, "Hey, look, I am just sharing my recovery process, and I made it very clear right from the start. It's a medical procedure. You don't know this condition. You have not gone through this condition before. You wouldn't know. So what? I mean, it's my choice if I want to share this process and my recovery with the people that I love, with the people that I want to help. Like you guys who are going through this, who are going to go through this, to help you know what is expected, and you know best that this is something that no one with the right state of mind will do if it's not necessary. Anyone with this underbite issue will first really want to go for an option that embraces will correct it. And it's that process we wouldn't need to claim any insurance. But this is not. This is recommended by the dentist, and he doesn't really care. He's the one recommending me go for the more expensive ward and everything. And now he's coming to me and saying that you're announcing the whole world as if it's a cosmetic. I say that, look, I'm just uploading my photo to share with the people who care for me, my recovery process. If you people want to judge of what I do, that's your problem, not mine. And he was like, "Oh no, I'm not saying it's you." I said, "I'm not saying you are the one judging as well. Why are you so defensive? I mean, you are the one that's doing all this, coming telling me all this, and now you're trying to push the blame on me. So what is this going about?" So I just want to say, some people, they're just so irresponsible and so unprofessional in what they do. They just want the money, and then they don't really want to follow up proper with you. So I don't know. I'm going to actually speak to him. He's saying like, sometimes in the court case, you wouldn't want to be too public about it. I say, "What, did I do something wrong? Why are you saying as if I'm doing something wrong?" You know, I, I really just cannot grasp my head around this. So yeah, there's some grumbling, but don't take me wrong. I'm not someone who grumbles a lot. I just feel that it's just, one thing I can't stand is the lack of professionalism in whatever you're doing. I understand you're doing this just for money, but you gotta do it with professionalism. That's all that matters, right? Yep. So I'll just upload this one, make it a short one, and then the next one will come on Thursday when I am done with the next follow-up process. Okay, so see you guys.